So tell us a little bit about the procedure or procedures you've undergone.
Right, well, the first one in November was with Mr. Schofield and a lumbar decompression. And that was caused because basically over a period of time I had got nerve pains in my back which caused me to limp and basically to stoop rather badly. And being who I am, I basically just put up with it, got on with life until one of my friends said, "What is the matter with you?" And I didn't know what was the matter with me. And then she said, "Well, you're walking so badly, and you're limping and you're stooping." And then I started to think, well, yes, perhaps I am. And I thought, well, perhaps some professional advice would be a good idea. And my friend happened to have been a colleague of Mr. Schofield, so she said he's the best man to go to. So I sought Mr. Schofield, and he did my lumbar decompression for me. And I think the most joyful moment was after coming out of the anaesthetic and the next day and getting out of bed was the fact that I could stand up. It made me cry because I could actually stand straight up, and I didn't have any pain, and I thought, he's a wonder man.
And then tell us about your hip.
Well, the hip was largely because Mr. Schofield wasn't quite sure what was causing the back pain, so he asked me to see Mr. Michael. So I went and had a consultation with him, and he also said, well, you do have an arthritic hip, which is not helping matters, and anytime you would like to think about a replacement hip, I'd be delighted to do it for you. So I thought, well, might as well strike while the iron is hot. So I asked when it would be the earliest possible moment to get the hip done after the decompression, and they told me that well, possibly 3 months was basic, and that there was an opportunity in January. So I grabbed it with both hands and had no problem. Absolutely no problem. I couldn't believe. People said, "How much pain? Was it very painful?" And I said, I feel a bit of a fraud because there is no pain. I don't feel any pain whatsoever. So I was a very good girl and followed regime, that you've got to be very careful because one of the dangers of a hip is dislocation. So if you do your exercises and you take things a little slower than normal and gently, it will all just fall into place. I kept on nagging to say, when can I drive, when can I drive? And 6 weeks is the answer. So I was given permission in 6 weeks to drive, which I did. And I basically haven't looked back. So I don't limp anymore. I can bend down. I have to be careful because I have to remember I have a replacement hip, and that maybe I should just think before you bend down and pick something up, because it is only 5 months down the line, so things are still in a tender stage possibly, although I don't think so, but one is a little more careful about things. But absolutely fantastic.
So good. Well, it seems like you've had a good, very positive experience.
Really positive experience. Anybody that is thinking about it, don't think about it. You say, well, why didn't I have it done sooner? You know, and the things that you didn't do quite so well because you were in pain, you possibly could have enjoyed a little more. So, yeah, do it. You've got to be positive in your mind, and the boys will do it for you.